Yeah, thank you, Chairman. Thank you for coming on out here today. I guess I just wanted to start by asking you, do you know what the the World Trade Center Health Program is?
I do.
What is it?
It's a program that for individuals who were in the World Trade Center or in the vicinity that may have been exposed to chemical compounds in the cleanup and the aftermath, they have the ability to get screening and care as appropriate.
For those that were there, as well as the heroes that were at Ground Zero afterwards, we saw a 20% cut in their staff in February. I asked the secretary about this. He said that he was unaware and did not realize that the funding cuts that he was making, that was authorizing, were cutting staff from programs such as this. I guess I just wanted to ask you, were you aware that programs like this would suffer, that this program would suffer from the staffing and budget cuts?
I was not involved in that decision-making, and I am not aware of what has happened.
So can you explain to me who was involved in that decision-making? So you were the acting director at that time in February. How did you have any input into the budget process?
I'm not aware of any of those staffing changes that transpired during that period of time or the budget processes. This is a critical, vital function that the CDC performs.
So in February, you showed up at work one day and they told you that, these are the cuts that are being made to your staff? Is that how it happened? Who told you that? Like, how did that unfold?
I'm not familiar with the specific details that you're talking about. I am happy to look into it and follow up with you.
So in February, when there were cuts to CDC staff, especially for the World Trade Center Health Program, do you recall how you were made aware of those cuts to the staff?
I am not aware of the specific details that you're asking about. I am happy to look into it and follow up with you if I am confirmed as a CDC director.
Yeah, look, I guess I raised this because you said earlier that a lot of what you want to focus on is creating evidence-based, rapid decision-making. You want to make sure that your actions are being driven by the data, by the science. Yet, some of the most important decisions while you were acting director seems like they were made without your knowledge, without your inputs. Did you agree with those cuts to the World Trade Center Health Program?
The World Trade Center Health Program is very important to this country. It is very important that we continue to support it.
You did not agree with the cuts?
Again, I'm not aware of the specific details of what you're asking about. I'm happy to look into it and follow up with you.
Well, it was just a little odd because they cut the staff. Congress, in many ways, bipartisan way, pushed back on this, and the staff were reinstated. I don't understand what the decision-making process is, and I guess that's something I wanted to get a sense of. What type of role would you play in terms of standing up against some of these cuts? If you disagree with them, what voice would you have? I guess I'll just switch gears a little bit here, just ask you, what do you think of Secretary Kennedy's performance and record so far since he has come in on secretary? How has he done in his job?
I think the Secretary has laid out a very clear vision for making America healthier again. I think he has prioritized key public health activities for preventing chronic diseases, for reducing maternal morbidity and mortality. He has emphasized his support for the rural health areas, his support for Indian health services.
Is there anything that is there a decision that he's made so far that you disagree with?
I think the Secretary is doing the important work of leading a very complex agency through a number of different transitions. He is supporting key priorities in preventing chronic diseases.
Does anything come to mind, though, that you disagree with him on?
The Secretary is doing the important work of leading a complex agency. He is supporting preventing chronic diseases.
There was a third of the staff was cut at the injury center, an incredibly important part of the CDC. Do you agree with that staffing cut?
I have not been involved in the decision-making.
Well, I understand that, but do you agree with it?
Look, the important work of public health is critical to all of the activities related to HHS. If I'm confirmed as the CDC director, I look forward to understanding what is happening within my own organization. I look forward to continuing to support these critical activities.
If you don't mind me asking maybe a slightly different way, do you know what the leading cause of death is for children in the United States?
there are a number of areas that we have to be concerned about for pediatric morbidity and mortality if they're within the purview of CDC in terms of preventing and detecting.
And what are the leading causes of death for children?
The leading causes of death for children. Look, this is a complicated issue, and we want to make sure that we're covering.
It's just a numerical issue. I'm running out of time. Unintended injuries, homicides, and suicides under the purview of the Injury Center. And I would just ask you to keep that in mind if you're looking at further cuts.